Good evening, everybody. This is a very strange and unusual moment. Things are unfolding as we speak. Literally 30 minutes ago, the Prime Minister announced a new set of restrictions. I guess one of the questions to kick off with, Peter, is it doesn't look, and I apologize, this is breaking news, so we're all dealing with this in real time with imperfect information, but it doesn't look as though there's been a lockdown imposed. I've just got an email from our head of facilities saying that the Met Police is saying that there is not a lockdown, but there is a new set of enforced closings of restaurants, pubs, clubs, and obviously certain stores and shops. So inching closer to Italy, Peter?
Unfortunately, I think the answer is yes, we are. And, the developments today, while I guess anxiety provoking for all of us are welcome. And I guess I find myself with the same question, is that why are we rolling these measures out so slowly, a little bit day by day, when we know the trajectory we're on? And why don't we just act a little bit more aggressively and a little bit more quickly? So I think this is the right call. I think we should have gone further, frankly.
So let's do a little bit of a kind of sense of where this pandemic is spreading and to what extent. And I think the piece of news that I was most interested in was Germany. Mm-hmm. There's a piece of reporting out of Germany which indicates that Germany has what seems on the surface to be an anomalous mortality rate. And by that I mean the number of people who have died as a percentage of the number of people who are infected seems to be very small. And this seems to be perhaps about the nature and extent of testing in Germany. But there may be some rather important global implications embedded in this data. So, Peter, tell us a little bit about what at least we're seeing from the partial data available from Germany.
Sure. So I may be developing quickly a reputation for turning good news into less good news. So apologies for that. But here's the situation. So Germany's had about 14,000 cases reported and only 42 deaths. By contrast, we had, I believe, 39 deaths in the UK yesterday. So even though we have a much smaller number of cases reported than Germany, Germany's death rate overall is lower. So the death rate, or the formal term is case fatality rate, is two numbers divided by each other, right? The numerator is the number of deaths, and that tends to be pretty accurate. People don't die in obscurity, right? Most folks end up in the hospital and they get counted one way or the other. But the number you're dividing by, the denominator, are the number of cases. And so that can vary wildly depending on how good a job you're doing of actually doing lots of testing and reporting those cases, particularly in people who are having mild symptoms. One thing we know about Germany, we talked yesterday about the amazing work South Korea has been doing to test 10 to 15,000 people per day. Germany is exceeding that, 20 to 25,000 people per day. So they have massive, massive amounts of testing happening. What that means is that they're picking up lots of folks with mild symptoms, they're picking up folks early, and they're counting all the cases. So their denominator is really big, but only because it's more accurate. I would not be surprised, based on comparing the death rates between Germany and the UK, if actually in the UK we have more cases than Germany right now. But we know that we're not testing because a conscious decision was made to really stop testing outside of hospitals. So that's the kind of difficult thing. Frankly, where Germany's epidemic is right now, it's probably a similar place to the UK, maybe even a little bit earlier, frankly. And I do suspect that over time, that death rate may go up a little bit as they start to see more of a surge. The majority of folks diagnosed in Germany so far have been younger, under 60. We know they tend to fare a lot better than those over 60. So while it's good to see, I wouldn't put too much stock in that, and we'll have to see how things unfold over time.
So I want to ask you a precise question, which may seem like a methodological quibble, but which I suspect is not. You said the death rate in Germany may increase. is it that the absolute number of deaths in Germany may increase rather than the death rate? Because if it turns out that we are able to have the denominator that you've set forth more accurate, that we can test more widely, and then we can see what the mortality rate for this disease is. And if it turns out that the fatality rate is in fact under 1%, or maybe under 0.6%, because we now know that we're testing the sheer number of people who have corona, then we start thinking of corona more as because the common influenza is sort of 0.15 is there or thereabout. So if it's under 0.5%, then it's not that it's not reassuring, because the sheer number of people who have it, the impact that it will have on our healthcare systems is non-trivial. But in some ways, it tells us that this is not as dangerous or virulent a disease as we perhaps thought. Or is that the wrong way to be thinking about it?
I'd be cautious in that. I think we probably have been overestimating the death rate overall, because again, there's always going to be this question of the denominator and how many cases. And over time, we'll be able to do various surveillance that helps us to get a better estimate of how many cases there really were in lots of different places. But we're seeing variability anywhere from about 0.5% fatality rate or death rate up until 6% or so. And Italy's, of course, closer to that higher range as well. There's lots of reasons, of course, that can vary. It's not just the kind of counting issues that we talked about. It's also about how early are you getting people? What is the kind of demographic distribution of your population? If you have more older folks in your population are getting infected, you're going to have higher death rates. And then, of course, there are lots of other factors related to the healthcare system itself, whether it's accessible to everybody and how well it's able to cope. So what we're seeing in Italy is a really high death rate because they can't give appropriate care to everybody who needs it. They're just overwhelmed. That may or may not happen in Germany. Germany's got a terrific healthcare system. They've ramped up the production of the numbers of ventilators in anticipation of what's to come. But we saw just today that Bavaria was all put into lockdown, that they are calling in the military to help put on more of a wartime footing. And all these are the right measures. It's possible the death rate will yet go up. Regarding the kind of, can we take solace in the fact that the death rate may be in some cases lower than we thought it was, I suppose I'm really wary of it's more like flu, so I don't need to worry thing, only because so many people have been sort of using that as an excuse not to take this seriously. And it's clear now, no matter what, that this is something really worth taking seriously, that it's going to cause a lot of disease and, of course, a lot of premature death.
So I'm really grappling with this moment because on the one hand, I've sort of, to declare my colors, been in the let's act swiftly and rapidly and contain. There's strong arguments to get ahead of it. Don't let the virus achieve escape velocity and get a handle on it camp. On the other hand, I did some kind of math today on air pollution. And let me run this past you and get you to think about it and react, because the WHO says that there are 7 million excess deaths a year that occur as a result of air pollution. That number is going to dramatically increase as we continue to pollute our environments, increase carbon emissions, engage in dirty industries that emit dangerous degrees, either diesel or carbon. So if 30% of the world gets the coronavirus, and if the true mortality rate is 0.5%, that's 10 million people who die as a result of it. 10 million people is a cataclysm, and one person is a cataclysm for the person who experiences it. On the other hand, 10 million people related to 7 million with air pollution, which this is ongoing and increasing, it will soon be that what we as human beings have just taken as normal, as a cost of doing business, as what it means to live in London or elsewhere, is going to kill as many people as the coronavirus, which hopefully is a one-time event, inshallah. You know, air pollution kills people like that on an annual basis. So is there something to be said for us as human beings reacting to things which are rapid and upon us in a very drastic way, and then not responding at all appropriately to things which are deep and structural, which have in aggregate the same impact, but which we've normalized and have become invisible? And is this a moment where we ought to be thinking a little bit more carefully about these two things?
Great question. I think the answer is absolutely. I agree with you. You could make the same argument about the flu, right? Seasonal influenza that we see every year, which kills upwards of hundreds of thousands, if not a couple of million people a year. And yet, in a lot of countries, the rates of flu vaccination are really, really low. And so we sort of tolerate a certain level of death that really would be preventable if we did a better job of it. With air pollution, it's the same. One caution, I suppose, with the numbers around deaths attributable to air pollution is that they're estimations, right? Nobody ever had air pollution as a cause of death on their death certificate. They had heart attack, they had chronic obstructive pulmonary disease, and so it's one factor contributing among others. And so there are a lot of sort of estimations that go into that. Obviously it's significant. But I think you're right that, this suggests not that we should be paying less attention to the coronavirus, but that in general, we should be paying more attention to these other kind of structural factors and other causes of preventable disease and death. And, likewise, we're going to see a little dip in our carbon emissions this year, which is one very small silver lining from the virtual shutdown of the economy that unfortunately is underway. But that's another kind of, sort of slow moving time bomb that we haven't been paying enough attention to.
So I'm going to get you to tell us some more slightly scary and unsettling news, and then hopefully we can end our conversation with some better news around discoveries and vaccines, etc. But you were saying before we started recording that there was some interesting news out of Spain. So tell us about that.
Yeah, we know that Europe has sort of become the epicenter of this pandemic at the moment, in terms of it being the place where the number of cases seems to be surging the most and kind of really reaching the tipping point of other countries being in a similar situation to Italy. France and Spain have been the ones that are closest. There are many others on the same unfortunate trajectory. So today, the Spanish Association of Intensive Care Doctors released a set of guidelines that included a suggestion that doctors should focus efforts on patients with more than 2 years of life expectancy, and to bring in considerations of, quote, social value into their clinical decisions. What that really means is that they're now approaching that moment when doctors and nurses have to start rationing care for the critically ill, and essentially having to be put in the terrible position of deciding who lives and who dies, which we spoke about yesterday. So that's a really a poignant and troubling sign that Spain has kind of reached a tipping point, and we may start to see the kind of trajectory that we've had in Italy the last few weeks.
Terrifying. And just upsetting that these are moral quandaries that can no longer be avoided, and that you need some framework. And I know you and others have been in those situations. It's just a terrible, terrible place to have to be. So is there any kind of news in the UK in terms of mortality or infection rates, or, I suspect that we're on an upward trajectory, but tell us where we are.
Yeah, we are. This is not the happy news part yet. I promise we'll get there. We're sort of in the quickening phase, right? We're on that kind of exponential growth curve. Estimations are tough because we are, again, intentionally not testing very much. And so I would not put much stock in the overall number of cases or the number of new cases, or even that kind of growth curve, if you were to look it up. What might be the most telling, I guess, one statistic and one anecdote. The statistic would be the number of deaths. And I believe there were 171 deaths reported in the UK thus far in total, and 39 of them were yesterday, which suggests that nearly 1 in 4 of all the deaths we've seen from this epidemic in this country since it started happened in the last 24 hours. So that's obviously not a great sign in terms of where we're headed. And the death rates are often used to extrapolate the size of epidemics when you don't have other kinds of figures. So I think that's telling. Second thing is that I've seen indirectly and then had directly in contact with colleagues some reports that the hospitals are really starting to fill up. One hospital in London where I was told that the ICU is full already. And that's not only with coronavirus patients, right? ICUs are already busy this time of year, but some places are already starting to see a real test on their capacity, and I expect that only, unfortunately, to become more significant.
Yeah, we had some communication with friends and colleagues at the Royal Marsden today. We'd done some prior work in communicating the incredible work they were doing in the work against cancer, and they are under siege and doing incredible work, but it seems that there are challenges on that front as well. So I wanted to pivot and ask you a few questions about vaccine and discovery, and what's in the pipeline, and whether we have some cause for hope and optimism there.
Yeah, one of the things that makes me hopeful is that as big and scary and global and uncertain as this problem is, it's all any of us are thinking about and talking about. And, there's an incredible amount of brain power and passion and innovation that's being unleashed against this virus in really sort of every direction. And we know that through our sort of, collective power, we have amazing potential. So just to focus on what's happening in terms of medical discovery, I'll talk about vaccines first and then some treatments. I'll try to keep it brief. There are at least a dozen different vaccines in the pipeline right now in laboratories and research centers all around the world, including 8 vaccines that either just started or are about ready for phase 1 clinical trials. Phase 1 clinical trials means testing in humans and healthy humans for safety, but it's the first step towards moving them through the pipeline and figuring out whether they are both safe and then effective. So at least 8 and more. And what's exciting about these vaccine candidates is that they're not all the same. A lot of them are attacking the virus in very different ways. And so you have a diversity of approaches that gives you more confidence that one of them is gonna stick and meet that safety and efficacy combination. I don't want to give false hope here. We will keep repeating that because you're giving this to healthy people, you got to make sure it's safe first, and you got to make sure it works. Guinness Book of World Record speed is 12 to 18 months still, and so we have a long ways to go, but very promising. On the drug side, there are any number of both sort of new and old compounds. We've seen some old drugs like chloroquine, which is an old malaria drug that's also used in rheumatoid arthritis that seems to have some efficacy against the coronavirus. Some suggestion that the BCG vaccine that a lot of babies get around the world might have some efficacy. There are some antiviral drugs, both existing HIV drugs and then also some others that had been developed previously for Ebola and others that have shown some efficacy as well. One called remdesivir, which has already been used in a number of cases and at least anecdotally seems to be helping some critically ill patients. So Gilead, the company that makes that, is now doing a compassionate use trial. So in some settings, doctors can request it for patients who are in really bad shape, and trials are ongoing. There was a big multinational trial announced yesterday that's going to be conducted over a number of countries. That's going to be a flexible, adaptive trial with 5 different arms, and it's going to be testing various combinations of these new and old drugs. So the hope is that we will find amongst all of this, yeah, the vaccine should come, but it's not going to come for a while. But we can have some hope that one or some of these combinations of drugs and therapies are going to show some promise, and so we can provide effective treatment for for those already afflicted. Really quickly, there's one more fun one, which is kind of it's like an old 19th century trick, which is taking serum from people who were infected and recovered, and then filtering out all the antibodies from that against coronavirus, and then injecting it into other people. And that can have some effect both as a treatment, but also as a preventive. So it's possible that that kind of treatment could be given to doctors on the front lines and help to protect them as they're caring for patients. possibly also as a treatment. So that's also being studied in a number of labs around the world.
So let me ask you two related questions. The first is, you say the Guinness Book of World Records is 12 to 18 months. I know that in some circumstances, some treatments, there are some ethical grounds to kind of abandon certain protocols if the death rates are such that the errors in trials, prior trials, may offset it. Is there an argument that we may be in a world where we could see acceleration?
Those estimates assume that world, that we try to remove at least all the regulatory barriers and move this as quickly as possible. And you see how much attention is being paid to this. Now, it's a little different if you're talking about a vaccine or a treatment. Treatment's given to people who are already sick. And so you can start with people who are at a high risk of dying anyways. They're the risk of getting something wrong with a drug. We can take that. Most people, most families would say, try anything, right? Save him. It's different with vaccines when you're given that to healthy people, and there's a lot less tolerance to risk healthy people dying as a result of giving them something that's untested. And so I think there is an argument for at least making sure things are safe and figuring out what the right dose combination is before you roll it out more widely.
So it seems, therefore, the quickest way to avoiding deaths as opposed to infections is obviously the treatment route. Right. And we have less strictures, and we're able to dispense with some of the kind of ethical questions that we would otherwise be bound by. Are we in a world that some combination of various kinds of treatments in the next 4 to 12 weeks could halve mortality rates? Is that fanciful thinking, or is that something that's possible?
That would be ambitious. I think that I would be not surprised if within 12 weeks we have discovered some effective treatments. That wouldn't necessarily be a magic cure where you take a pill and you're good, but that at least is going to help to slow the disease down and save some lives in some people. Depending on what that is and where it came from and whether it's new or old and how quickly its manufacture could be scaled up would really determine how great an effect that could have. Now, a lot of the companies that have promising drugs are, A, their stock is surging, B, they're investing a lot in their ability to ramp up production quickly in the event that it shows some efficacy. So, I got a lot of faith in the power of human ingenuity, and everyone's working collectively on this problem. We know that every necessary resource is going to be made available for anything that's promising. So I'm hopeful. Having mortality in 12 weeks would probably be a lofty goal.
Okay.
Let's try.
But that would tend to say that the kind of flatten the curve, lock yourself down, if there's a cure in 18 months, well, then, this is going to run itself through the population. If there's an attempt to reduce if it's vaguely feasible to reduce mortality rates even by 20% or a third, 20% or a third of 10 million people is a colossal number of lives saved. So it sort of then pushes you back into the world of being more draconian in social distancing and all the things that draconian is not the right word, but being more robust in seeking to, limit the spread.
I think that's right. I mean, my view is the primary goal is to save lives and avert preventable deaths. And if that's the case, then buying time is so important right now for all the reasons that you mentioned and to protect the health system. There's obviously a lot of other factors. We're going to potentially plunge into a depression, if not a significant recession. There's going to be a lot of challenges related to the sort of economic and other difficulties that have to be weighed in. For me, at least, my calculus is all about lives first. And so I think that's the only acceptable approach.
Some questions that have come over from people who have joined us. One of them is this question about uncooked food, fruit and vegetables in supermarkets that may have been coughed on and then you take home to wash but not cook. So question one is real risk, question mark. Question two is, if you go anywhere that you're having food prepared and delivered to you, can the person who is preparing the food transmit the virus in the food to you? So two questions.
Yeah. So first off, wash your fruits and vegetables. It's good practice. If you're buying organic, there could be dirt. If you're buying non-organic, there could be pesticides. No one studied whether, we know that the virus can live on surfaces for some period of time, usually hours, in some types of plastic, at least in the laboratory, a couple of days. No one's, I think, studied the surfaces of fruits and vegetables, so I can't say for sure. I would think that even simple washing it would reduce any risk to a really trivial amount. So you need your fruits and vegetables, keep eating them, stay healthy. In terms of delivery, contamination of food, I suppose, is possible. I would, if anything, say there might be more risk to the contamination of the outside of a takeaway container or something like that than there would be of the food itself. And so if you're getting food deliveries and you want it to be really, really careful, I would say that, take care with the outside of the container itself. Maybe you open things up and then you wash your hands and then you eat, etc. Even that's going to be a relatively small risk, but theoretically, if the delivery driver were to cough while he or she was holding the box or something like that, it's possible.
There's a question from yesterday. Said, regarding social distancing, is it acceptable to go for a walk in the park with friends without coming into contact with others? And can I still go running outdoors in London?
Yeah, so I think that being outside is a great idea and it's really important, and we're all going to go stir crazy if we're locked up in our houses 24/7 for the next who knows how long. So I'd really encourage people to get outside, especially get outside and engage in a little bit of physical activity. You want to avoid crowded spaces and close proximity to others still. So going for a jog, going for a cycle, those sorts of things generally should be fine. Getting kids out to parks within reason, I think, is fine. Playground equipment and lots of other kids and things like that, maybe that's a bit of a question mark. If you're going for a walk with a friend and you sort of keep some distance and raise your voice a little bit so you're not walking side by side, but you're keeping a meter or so apart, I think that's also fine. What you want to do is avoid prolonged close contact of less than a meter or two with others.
There's another question around infection trajectories in low and middle income countries, India, South Africa, which currently have low cases. I've seen that it's beginning to take root in the global South, and is there every reason to believe that it will be as devastating there, if not worse, given transmission and low healthcare infrastructure?
There's reason to be concerned, and lots of us have been saying this since the beginning, that if this were to hit and to take off in a lot of resource-constrained countries in the global South, that it could be challenging. Right? There are places that don't have intensive care units and things like that. We haven't seen a real takeoff there yet. We don't know how much is that there hasn't been a lot of testing versus whether there is a climate related thing. In a lot of the Southern Hemisphere, it's sort of summer, early autumn now, as opposed to winter, early spring. And so it might be, if there's a seasonal pattern with this particular virus, that as we move towards our summer in the north, that things might take off more in the Southern Hemisphere. That's speculation. I don't know that to be the case. One other interesting thing that I would say is that a lot of countries in the global South, and certainly on the African continent, are a lot less complacent than I think Europe and America were early on in this epidemic. And I think that's because it's more real. A lot of countries lived with or had to worry about Ebola in the last couple of years. And epidemic disease has been more a fact of life. And so there are not only some systems in place, but I think that people were much quicker to take it seriously. And so we've seen some aggressive efforts in at least some countries that actually we didn't early on. There's a lot of sort of denial and complacency here in the West. So we can take that as a sign for hope, but it's only going to take some time to tell.
And a final question, Peter, just on both from a human perspective and from a business perspective, trying to anticipate when things might return to normal, discounting the enduring economic impacts, which will be with us for, I suggest, quite some time to come.
Hmm.
Um, but when is it that we're going to be able to have dinner parties, gather together, go to music concerts, hang out, kiss our friends? When does that likely to happen?
This is just a guess, so don't put anything, too much stock into this. I would suggest not less than 3 months, and possibly a year to a year and a half. And there's a lot of middle ground between where we are or where we're going to be in terms of kind of being very isolated, and mostly being stuck at home and most businesses being shut down, and back to normal. And what we might see is that there's going to be a lot of kind of in between. Hopefully we'll get this thing under control. And then we have to start to figure out, how do we get back to some semblance of normalcy, some semblance of economic activity, some semblance of physical human interaction without increasing the risk of this thing coming back? That's where South Korea and some other countries are kind of contemplating right now. So there may be that in-between phase. It may be that we have some loosening and then we have to tighten back up again. It might be something that we have to manage over time. I don't know. It will take some time. I think we're headed, at least for those viewers who are in the UK, I think we're headed for an essential virtual lockdown over the course of the next week. And I don't think it'll be a 1 or 2 week thing. I think it'll be a longer term thing that might take us towards the summer. The other, I guess, big thing to think about, maybe as a takeaway, and for lots in our community in the Conduit who are working on sort of social innovation and trying to address lots of different issues, is what's the world going to look like in a year? And when we get back to normal, is it going to be the same, or is it going to be a new normal? And what is that going to look like? I think we're going to be forever changed. I don't know exactly what that looks like. There could be some interesting things that come out of this. There could be some interesting opportunities that come out of this. And so I think it's worth, once we can sort of take ourselves out of the immediate day-to-day of trying to keep ourselves and our families safe, of really just starting to think about how the world is changing, what some of this stuff means, and how we can make sure that the future that we're headed for is going to be better than the one we're leaving behind.
I think that's a perfect note to end. Thank you for your time again on a Friday night. Thank you everybody for listening in. We'll obviously be posting this and rebroadcasting it so it can be watched again and sent to other people. And we'll have you back next week. So thank you very, very much again, Peter.
My pleasure. Take care, everyone. Have a great weekend. Stay safe.
Stay safe and stay well.